Hey everybody, this is Joe. I'm at Victory Wellness Med Spa in Cincinnati. There's also a location in Naples. And I'm here with Dr. Magdalena Kerscher, and we're going to talk about the new award for hormone replacement therapy and talk about what is hormone replacement therapy and how can it help you.
We were recently voted the best clinic for hormone replacement therapy for Cincinnati. I just want to say big thank you to all of our clients, patients, friends, families, whoever voted for us out there to give us this honor to be the best in Cincinnati. We've been doing hormones since 2014. We certainly have thousands of happy clients that we have changed their lives, and they're after 50 they're leading a wonderful life, traveling, sleeping well, having great marriages. You know what I love when my clients come in and say, how are you today? I always get, I'm great. So this is a very rewarding job for me, is to be able to help so many people reclaim themselves after 50.
So the nuts and bolts, hormone replacement therapy, how do you know, like what are some of the symptoms if you're low on hormones? How would you know that you need this other than just being over 40 or over 50?
Well, I think that the biggest dip for women is right after 50. The mean age of menopause is usually around 52. And what happens to us women, basically, I call it we derail, the train gets off the track. That's the best way to describe it. It happened to me. I've been on hormone replacement for a long time myself. And so what happens, suddenly you feel you can't sleep, your mood changes, you're irritable or depressed, or anxious. There are pretty much the states of mind that a woman has. Your sexual function goes south. You have painful
like loss of libido or pain?
Pain, loss of pleasure, loss of libido, lack of interest. And that is not psychological most often in here. It is hormonal related. It's to the loss of estrogen and testosterone that controls all this in a woman. Inability to sleep is huge. People come in, especially women. I can't sleep. I wake up at 3. Then I have to go to work. My life is a mess. I hear this. I've got hot flashes, night sweats. You know, I can't. How do I get through a board meeting with dripping sweat all over my suit? Those are real concerns of real people out there. Who are still functioning. Progesterone I call the happy hormones, very anxiolytic, helps sleep. Estrogen, the beautiful one, helps our skin, prevents early wrinkling, gives us the glow of the younger woman, full lips. This is all the function of estrogen in our body. So it's not just for reproduction, to have children, as we've been told. It controls our brains, prevents Alzheimer, estrogen and testosterone. That's huge, since most people with Alzheimer are women. Not men, but women. Men too, but it's predominantly women. It's often estrogen related. Heart disease is estrogen. Lack of estrogen, natural estrogen, increases risk of heart disease for women. And heart attacks. Bones. What happens to us women? After menopause, we lose 5% of bone per year. So think about it, Joe, 5% starting at 55. By 65, you have 50% bone loss. That's huge. And this is why we see after 65 hip fractures. In about 50% of women.
You always see.
Spinal fractures. It's terrible. So the consequences of low hormones are huge in our society. So replacing those hormones is highly beneficial. There was a research study that came out about 2 years ago that showed that estrogen actually prevents breast cancer. Huge study came out to reverse the old thinking that estrogen causes breast cancer. It actually prevents breast cancer. So we don't have all these old fears anymore about hormones like we used to. The science is beginning to show us that actually it is beneficial. And I think as you see my clients and myself, we've been on it for a long time, you'll see that we're not diagnosed with new chronic diseases. We don't develop diabetes. We don't have heart attacks in my clinic. I have not seen a patient suffer from these conditions in here, although all of us are aging. All of us are over 55 pretty much. And so I am a big believer, and from what I have seen in myself as well as my clients, it's a game changer for the second part of our lives.
And these aren't the hormones we talked about in the 80s. These are bioidentical hormones.
Right.
Totally different.
The hormones that I use are bioidentical. They're superior to synthetic hormones because they are natural to the hormones that our body naturally produces. Okay? They actually are produced through recombinant DNA technology. So they're basically DNA programs that say estrogen. Right?
Okay.
And so what we can do today in the lab, we can take the piece of the DNA from a woman and actually create the identical estrogen that she should have in her body.
Okay.
And that estrogen binds to the receptors the right way, it clears to the kidneys and liver the right way, just like a natural hormone that her body's familiar with, versus synthetic, which are basically old, it's a horse's urine estrogen.
Oh my God.
Estrogen taken from horse's urine. And it is also manipulated a little bit by the pharmaceutical industry so they can be patented, because you can't patent natural substances. And unfortunately, it does help symptoms some, but it's foreign to the body. It's metabolized like a drug in the body. It binds to the receptors like a drug. The body's not familiar with it, therefore it has side effects.
Gotcha.
That are like, there was some incidents of increased breast cancer, heart attack, strokes in women over 65, weight gain, the women complain, which you will see the opposite with natural.
Those are all the old hormones,
right?
The synthetic ones that
hormones.
do that.
Yeah.
Mm-hmm. So if a patient comes in, man or woman, what are some of the way? How can you apply the hormones? Is it a shot? Is it a?
So the bioidentical hormones can be applied many different ways. It depends on personal preference. So we can do creams, patches, by mouth, or implants, pellets, which I think majority of people prefer, because you do your pellets, you can forget about it for 3 months for a woman, 6 months for a man.
I gotcha.
So it's based on individual preference.
So you need a cream, a shot, and the pellets. It's applied under the skin?
Yes, the pellet is a grain of rice, size of the grain of rice, and it's put in under the skin, usually in the buttock area.
Okay, how long does that take usually?
The procedure?
Yeah, the procedure.
Oh, 10 minutes.
10 minutes? Oh, so you're
a
in
little
and
longer
out.
for a man, because he has to sit for about 20 minutes after the procedures on an ice pack.
Little ice pack. And you take people's levels after this or during the...
Yeah, so what we do laboratory studies prior to insertion of hormones. We want to see what your hormones are. We also do a little bit of a health screen as well to make sure that we can correct things early if there's something abnormal, and help you be your best. And based on the lab's values that you have of your hormones, we choose the dose for you and your age and your height and different things like that, which you might need, and then go by your symptoms, and we fine tune and adjust as we go along to find what I call is a hormone sweet spot.
Oh, yeah.
Yeah, hormone sweet spot. So when the hormones are just right, you feel just right.
Yeah, that makes sense. You just feel normal again, right?
Again, exactly.
What do you think the biggest benefit for you was? Because you say you've been doing hormone replacement for a while.
Oh yeah,
what
for a long
what
time.
is your
Since
biggest
49,
benefit?
I had this wonderful OBGYN that got me started on bioidentical hormones. I knew nothing about it. I didn't even believe in menopause.
I don't think most people know.
I was such an arrogant doctor. I didn't even believe in all this stuff. Yeah. And I just had a very, very wise OBGYN. And for me, well, I in my book, what I talked about, you want to show people my book?
Get your mojo back.
Get your mojo. I got my mojo back. And first of all, she started me I had some bleeding in my late 40s. She started me on progesterone. And what I noticed that my bleedings have stopped in about a week. And then another miracle I've noticed that I could sleep again. I haven't slept for 5 years. But I blamed it on the kids, on the husband, on the job, on the boss. The usual, right?
Stress.
That's stress. That's why I can't see. Lo and behold, I'm sleeping like a baby from this new magic pill. And that's what got me so interested. And, my irritability that I had in my late 40s is, I call it 1 second to a bitch that women have. It's that fuse that just blows.
Yeah.
And it's a very real thing. It's hormonal. This is not psychological. It is hormonal. That went away.
Yes.
I took the pill and suddenly I'm normal again. I quit when my husband used to shave, I could kill him. It just really grated on my nerves, which was not a normal reaction. But when I had my progesterone replaced, all that kind of just calmed down, and I'll calm down.
And the same with men with testosterone.
Yeah,
it'll
men
help
with
the stress,
testosterone.
the calm.
Yes.
Does
yes.
it have the same effects for the heart for men? Because I know you always think
bioidentical hormones actually, because they decrease visceral fat testosterone and increases muscle mass in a man, it actually increases the chances of not having a heart attack.
Oh, okay. And I actually know someone who's on bioidentical hormones, and they actually experience better beard growth.
Oh, for sure.
And stuff like that.
Absolutely. Testosterone stimulates hair growth in men.
Okay.
Absolutely. That's all testosterone driven.
Okay, so
sex drive, some of the sexual function in men, muscle mass in men. Frequently when men come in, the problem is, well, I'm exercising for 2 hours and I don't see any more muscle anymore. When I was young, I used to just put on muscle when I exercised. Well, that's because their testosterone's been low.
Gotcha.
That's the reason for that. So they're just not building muscle like they once did, even though they exercise. So.
And what is the age do you think people should start looking for this? Do you see younger people with some of these symptoms, or is it like 35?
We have people with PCOS, polycystic ovarian syndrome, which is a problem with actually young women, younger women. And very often that comes with thyroid abnormalities and progesterone deficiencies.
I gotcha.
Okay, so they can start very young. I've had people 18 and even one 16 already. Yeah, that really benefited.
Okay.
You know? But typically what we see for anti-aging, 45, I would say for women, where that's when we start losing progesterone.
Okay.
And that's when the symptoms start appearing of pre-menopause, which is the irritability and the ability to sleep. And women don't know what's wrong with them and they start looking for help waking. Men, I think after the age of 35, men start losing progressively, I think, testosterone.
Okay.
So could be really, I've seen men as young as 35.
Okay.
I've had. In their 40s, but again, typically 50.
Okay. And once again, we have our Best in Chic 2022 Reader's Choice Award for hormone replacement therapy, Victory Wellness in Cincinnati and in Naples. And we want to thank you today for talking with us.
Well, thank you. And we have many great feeling clients out there.
Yes.